Welcome, everybody. Thanks for joining us this evening. We're here to have a wonderful conversation with some knowledgeable folks about our COVID pandemic. What we're hoping to do is provide some good information that will be useful to everyone, help to give them more information about kind of the efficacy of the vaccination, and also in the process dispel some of the common myths that are out there, hopefully just to keep everyone that much more safe. So I'm very pleased to be joined with a couple wonderful distinguished community members. On the end there we have Garrett Gilazzi from the Health District. He is the Health Commissioner at the Ross County Health District. And then next to me I have Dr. John Gavis, who is the Medical Director of Community Partnerships at Adena. So I thought maybe what we would do is start the conversation by just turning things over to Garrett to maybe give us an update of how things are looking in our local community.
Sure. Thank you so much, Dean, for having us today. It's considers to be a very timely and important topic, and I'm hopeful we'll have some good discussion tonight and dispel some rumors and encourage some folks to get vaccinated. So with that, I think it goes without saying that September was an extremely busy month, both for us locally at the Health District, across the state, across the vast majority of the country, in public health, and for our healthcare systems. In September, we saw a significant surge of coronavirus cases, specifically related to the Delta variant. So prior to September, the busiest month for the number of cases we had was in December, and in September we surpassed that. So we had almost 2,000 cases reported to us at the Ross County Health District in September alone, compared to just over 1,800 last December. So an extremely busy month. And when we pair that with kids going back to school, festivals starting, holiday weekends in September, it just made for the perfect environment for a high amount of community spread. So today, Ross County is sitting at 344 cases per 100,000. Our highest was 1,094 cases on September 16th. So in just a few weeks, we've significantly seen a decrease in cases, which is good news. The state average is 507 cases. So when we look at community spread, we're really concerned with the case rate, and anything above 100 is considered high. So when we went over 100 at the end of July, that's when we sort of modified our guidelines and recommendations again to really anticipate this surge that we saw. So I'm very hopeful over the next 3 to 4 weeks we will decrease back down to 100 or less, which is where we were all summer. So now that vaccines are more widely available, we should have good reason to get back down to 100 cases per 100,000 or less. Just a couple other high points I wanted to share. We are currently averaging about 35 new cases of COVID a day in our community, and about 10 to 15 of those cases a day over the last 2 weeks are individuals under the age of 18. So we continue to see spread within our schools and much more younger individuals testing positive for COVID. During the month of September, we reported 114 hospitalizations within Ross County, and so far as of October 14th, we've had 21 cases reported in the month of October. While the surge has been going on, one of the things we've noticed is we have seen an uptick in vaccines. So I think, as more people know someone who's been severely impacted by COVID, that alone has been enough to really change people's minds. And our motto at the Health District is, if we can't change your mind, whenever you are ready to make that decision for yourself, we want to be able to provide you that vaccine in a quick, timely fashion. So currently, about 46% of our population in Ross County have started their first dose of their vaccine, and about 43% have completed both doses. So ultimately, in the next couple months, I would really like to see us hit that 50% mark. That really proves that we're on the right track. We're getting there, but it's slow. The lowest vaccinated group of individuals in the county continue to be our 12 to 19-year-olds. Just under 13% of our 12 to 19-year-olds are vaccinated. So we know that there is some hesitancy out there, and I think we're going to discuss that tonight, but that's really the state of really where we are in Ross County. I feel much better going into the rest of October than I did in the beginning of September.
That's wonderful. That's wonderful. Dr. Gavis, I'm wondering if you'd like to comment on any of the issues that were just mentioned by Garrett, and particularly some of the things that are plaguing our particular community. Are there?
Sure. In the time period where we had the surge in previous months, we maxed out our inpatient census of those with COVID at 60. But last month we maxed out at 90. So the Alpha variant was the 60. The 90 was the Delta variant. And of those people who were sick, they were much sicker. I don't know what the mortality rate is yet, but as we look back, I think we'll find that the Delta variant, and I know I'm not supposed to be touching my face for all those people out there who are saying that just better to have a mask on. But the Delta variant has been much more infectious and transmissible. And that, of course, has strained the healthcare resources at Adena. We have so many nurses and so many doctors and so many techs and other workers that whenever you're at 100+% of capacity, it's very hard to care for all of those people. And actually, we suspended elective surgeries that you would have to stay in the hospital for a period of weeks, because we wanted to be sure that as we saw the surge, we were allowing enough space for those people who needed to be hospitalized. That stress of the resources has been felt all across the health system. It's been felt, I'm sure, at the health district. It's been felt in physician offices and all over the state. So it's really hard as you're trying to take the best care of people that you can. It's really hard when you're that stretched to really do a great job. And then the mental health of the caregivers is at risk because just it's so intense and so stressful over time.
I wonder if you could talk a bit about the variants. That's something that we hear a lot of, and I don't know that people really understand what's involved with that and what that is.
Sure, I can start. As we mentioned, the initial sort of wave of COVID consisted of the Alpha variant, and what we've been dealing with recently is the Delta. And essentially what we're seeing is as transmission continues around the world and affects different populations at different times, the higher the transmissibility or the ability for the virus to go from one person to another without that barrier of vaccination really lends itself to mutating. And so for each one of the variants, there's just a slight mutation of the virus itself. Sometimes there's a variant that doesn't allow it to be more transmissible or cause more illness. And in other occasions, like the Delta variant, it does. And so one of the misnomers is we use probability to describe that the Delta variant is the leading variant. Because not every sample that's taken, when you get tested for COVID, your sample doesn't automatically get genetically sequenced to determine which variant. There's really a tiny percentage of those that are sequenced. And that's for a couple reasons. One, it's significantly expensive to sequence viral genomes. And it can only be done on PCR samples. So the rapid tests are not able to be done. And after you run the general PCR test itself to see whether or not you have COVID, there has to be enough of that sample left to send to a laboratory to be sequenced. So once we get to the point where almost all of those samples that are sequenced become from the same variant, then we're fairly confident saying that that is the dominant strain right now. And that's really what we saw going into the end of July, August, and then through the surge in September.
Great. And then, so if we wanted to protect ourselves from this, the most we're all wearing masks here, obviously, and as I'm looking out, what you all don't see from my vantage point is I'm looking at an auditorium that has a bunch of X's on chairs to ensure social distancing, and we know that the vaccination is out there, right? So what are ways that we can protect ourselves? What's the best way to protect ourselves? Just doing what we're doing now? What will you say to people to help encourage them?
I would say, first of all, vaccination, because that helps you avoid serious illness. No vaccine is 100% effective at stopping every illness. However, with the COVID vaccine, it is extremely effective in the high 90% effectiveness for preventing you from being so sick that you're going to be in the hospital. And more importantly, it helps prevent you from being so sick that you die. So the vaccination, the reason why the vaccination is so important are those two facts. And then what you can do with that being vaccinated, you're less likely to spread. You can still spread, but you're less likely. So I've been trying to think of an analogy of how we want to be protected, and no one thing that we do is 100% effective. But to be the most protected, we want to stack up as many things as we can that will allow us to be protected. So, for example, hand sanitizing. If we touch our face, like I've unfortunately been doing to keep my mask up, when we sanitize our hands, that decreases the virus on our hands. When we stay 6 feet away from others, and if there's virus around, we're less likely to come in contact with that. Wearing a mask, cloth or other, decreases how much droplet spread there is. Is it perfect? Heck no. But it decreases enough so that as we go and we line up all of these protective mechanisms, we're giving ourselves the best chance to not become infected or even to spread the coronavirus. There's no magic bullet. There's no magic one thing. The vaccine is the most effective way of stopping this. But shy of 100% vaccination, it's lining up all of those preventive measures so that we're able to stay as protected as possible.
Yeah, I would add in the beginning, many of you probably heard about this Swiss cheese model. So in epidemiology, we really look at a layer of, a mask, social distancing, vaccination, each as a layer. And as you place pieces of Swiss cheese on top of one another, the likelihood that you're going to find a hole that goes through all the pieces decreases. And so really these tools are to stack on top of one another to increase the protective measures we have from actually getting COVID and then transmitting COVID to someone else. I think, this has been a pandemic of learning. Virtually anyone alive today has really not survived through a previous major global pandemic, unless, of course, you were born on or before 1918. But, in the beginning, we did have confusion. We've known about coronaviruses since the 1960s, but there's multiple coronaviruses. There are some that cause chest colds, common colds, and then there are some like MERS and SARS that can lead to a global pandemic. And so we had to really think of ways how this virus was transmitting. And so we know that it is transmitted through aerosolized droplets, which means it has to have some sort of vector. And so masking continues to be one of the best tools to prevent you from inhaling those droplets from someone else. And so vaccination, definitely, masking, second to that.
So thank you. I think there are a lot of myths out there about the vaccination, about some of the practices that we're talking about that are meant to keep us safe, right? And so I'm wondering if we could maybe start talking a little bit about some of those myths, and I'd love to get your take on what's your reaction to some of these. One of the most common that I hear has to do with people being concerned about the vaccination somehow being rushed through. The approval process has been rushed through or something, and so people would rather just kind of wait and see and until it's really safe. So the idea is that somehow the FDA has set up the process, and in doing so, it's not quite as good as it perhaps could be with more time. What kinds of
Sure.
things?
I think, that's a common question we get too, and I'm sure it's occurring in physicians' offices and healthcare facilities everywhere. I can tell you more people have taken the coronavirus vaccine than any previous vaccine created. We're talking about billions of doses around the world that have been given safely. When the world is all set on one thing and there's virtually an unlimited supply of money, this pandemic teaches us that we can get and accomplish virtually anything. And so when every vaccine manufacturer and every scientist and every lab and every university is focused on creating a vaccine for one specific thing that we've identified, it can happen. That doesn't mean that we bypass clinical trials or that we sped it up and skipped steps in the process. That is just not true. One thing that did occur is multiple clinical trials were occurring at the same time. Normally those would have been staggered, but because there were so many different vaccine manufacturers doing this, we were able to start multiple clinical trials at the same time. That in and of itself saved months and months of time it would have taken. That doesn't mean it wasn't tested on the same number of people it would have been under normal circumstances. It just occurred simultaneously. And then, we have often in the past, in public health emergencies, utilized emergency use authorization. So this is a tool where the federal government and the FDA can authorize something to be used in an emergency when the data shows that the benefits outweigh the risks. So when we have all of that information together, paired with the technology of an mRNA vaccine, which really started in the 80s, it was the perfect timing for us to be able to accomplish this in this time period. So, I've heard that hesitation myself. I always counter with, eventually it's going to be too late for you to decide to get vaccinated. And the last thing the medical community wants is for an individual who is getting ready to be intubated and put on a ventilator begging for a vaccination, because at that point, it's too late. So I would encourage you, if you think if it's rushed, look at the data. Virtually, everything points to the safety and efficacy. And the last thing I would want is for you or your loved one or a family member to really wanting to get vaccinated before it's too late.
So one of the data points with the Johnson & Johnson vaccine specifically was the increased risk of clotting or having serious side effects. While they are present, they're very, very rare. And my data says 15 cases in 8 million doses where there was serious clotting problems. So is there a risk? Yes. Taking a Tylenol has a risk. Driving to the grocery store has a risk. And the risk from any of the vaccines for any of the serious side effects, the benefits of preventing COVID far outweigh the risks of the potential of having something, having an untoward side effect. The COVID infection is much more serious than the side effects from a vaccine in a population. Now, does that mean that every individual is okay? No. In a population, millions and billions actually of people, it's safe and effective, or it would not be offered if it weren't both safe and effective.
Yeah, it's good that we often forget about the science behind these decisions, I think. we can get caught up in other factors perhaps, or consider other factors. I'm also wondering, I've heard a lot of conversations about the difference between the vaccines that are available to people now. Is any one better than the other? Is there any reason to go with one as opposed to another?
The best vaccine you can get is the one available to you. And that is still true. We know that both the Moderna and the Pfizer and the Johnson & Johnson vaccine are all safe and effective. They prevent people almost 100% from dying from COVID after you're fully vaccinated. So are there breakthrough cases? Yes, there are. But there are breakthrough cases with any other vaccine. We can't, overlook that. That data is still ongoing, and we evaluate each one of those breakthrough cases. But the risk of you dying after you're fully vaccinated is almost 0%. So the vaccine available to you is the vaccine you should definitely get.
And there are a few specifics about the vaccines. For example, the Pfizer vaccine is the only one approved for children 12 to 18. The others are approved for folks 18 years of age and older. So the Pfizer has additional benefit in that lower age group because it's been studied in that group.
Is that one of the reasons why you think there are fewer, or it's harder to get the younger people vaccinated these days because there is just that one, or are there perhaps other reasons that?
I would say initially, yes. I think that was a concern. The vaccines were, for a while, very limited in supply. That is not the case. There is an overabundance of vaccines available to everyone in this country, all three of them. I think the hesitancy just comes from common misinformation. During almost the entirety of the pandemic, many individuals were not seeing their primary healthcare providers. Those conversations from school nurses, peers, we were in lockdown for months. We didn't go anywhere because of the unknown. And I think that really fed into a lot of fear about this process. And so I think that has dealt a lot of it. People are nervous about getting their young ones vaccinated for what if there are long-term consequences. Well, nothing in the science, nothing in the ingredients even points to a possibility of a long-term consequence from these vaccines. And so I think it's conversations like this and conversations individuals have with their family who have gotten vaccinated if they're similar age, with their primary care providers, really to understand that, look, at any age, if the vaccine is available to you, the benefits outweigh the risks of getting vaccinated. So I think that's just where we have to continue to really chip away at that. I am hopeful that as Pfizer becomes approved very soon, hopefully the first week of November for 5 to 11-year-olds, we will see more families come in who have, children in both of those age groups, 5 to 11 and 12 to 18, really getting everyone vaccinated at the same time.
Do you want to add anything, Dr. Davis?
No, Garrett is well versed on that, and one of the things that I'd like to point out throughout this whole process is this was science in action. So we learned about the germ theory with Louis Pasteur, and that was developed over tens of years, if not centuries. In the last 19 months, we have seen science advance very, very rapidly. And that requires that there be adjustments. Whenever you have new information, you do things differently. So has it been confusing to everybody? Is it confusing to Garrett, to me, and to our patients? Absolutely. How do we keep up with these changing requirements? And that's where we communicate. We look at the science as it comes from trusted sources. So that's an important part.
Wonderful. Looks like we're being joined by Dr. Michael Jones, and I'm very pleased that he's joining us. Dr. Jones is also from the Adena system.
Good evening, everyone. Pleasure to be here.
So we were talking about the youth and the implications we're trying to encourage more younger folks to get the vaccination. And I think there are a lot of myths out there about youth that maybe putting people off or making them hesitate about encouraging their children to get the vaccination. One of the most predominant that I've run across has to do with perhaps the vaccination causes infertility, or there are fertility issues that come up. I don't know if any of you have run across that, or if any of you would like to comment on that.
There is no science that says that women become infertile or men become infertile with this vaccine. So that is a science fact that no scientific data has come up that says women have miscarriages due to the vaccine, or that they have any difficulty with childbearing. Now, with that being said, we're still in a time when there's going to be a lot of data gathering and retrospective looks, but right now the science says there's no issue.
So if I were pregnant or if I were breastfeeding, is that a reason for me not to get a vaccination, you think?
I will take this one. It is highly recommended. If you are pregnant, you should be vaccinated for many reasons. One, we don't want to have you be exposed and then contract COVID and help cause other issues while you are pregnant and during your pregnancy, but also to provide those antibodies for your unborn child. That way, they really do have an opportunity to have sort of a head start of protection prior to them being born. So the science is clear. ACOG, AAP, all of these medical bodies, as well as the CDC and FDA, have really encouraged strongly that if you are pregnant, you should be vaccinated with any of the 3 vaccines.
Are antibodies passed through the breast milk?
And so that's a very good question, Dr. Jones. In low levels, they can be, yes. That is one of the areas that Dr. Davis, I think, highlighted, where we're waiting on more data, what that looks like long term. And I think one of the reasons why we don't know that currently is because I hate saying this, perhaps it was a lower priority scientific item than it was through antibodies passed through in utero, and then some, studying with any underlying conditions. But currently, yes, in low levels, they can be.
So prior, in getting ready to make sure I had current information for today, I was on the CDC website and looked up some of their scientific citations, and actually a woman who has been vaccinated passes a significant amount of immunity to their unborn child. Whenever it's in utero, inside the mom, it is highly transferred through the placenta to the baby, which then leads to immunity for the baby to a degree.
Very good to know, important to know for everyone. So I've also heard, I'm just going to tick through some other myths, if that's all right, that I've heard, and maybe I'll get your replies to that. There are some people out there who think, well, I've had 1 dose, that's good, I'm protected, I don't really need to go back and get the other one. And particularly, I hear this with people who maybe had experienced some side effects from that first dose. They think, oh, I'm not going to do that, I'm good now, I'll just keep continuing on. What kind of advice, or what would you say to that line of thinking?
I would say the first dose will give you an increment of immunity, but the studies, we keep going back to the science says that the second dose is what gets you to a higher level of protection. So are you protected to a degree with the first vaccine? Yes, to a degree. But by getting 2 doses of an mRNA vaccine, you get to a much higher level of immunity. So the only way to say that is just the second dose helps a lot more than just one dose.
I think it's important too that the information that we pass on to our patients is just based on evidence-based medicine. So the trials show that 2 doses are more effective than just 1. And just to echo what Dr. Davis said, and 1 will give some immunity, but for the maximum amount, 2 doses are required. The mRNA vaccine.
And we're seeing that now. I mean, today the FDA's committee met and talked about a booster dose for Moderna, which has not yet been approved, but is well on its way. And we know with Pfizer, individuals are eligible for a booster dose if they're at high risk, or if they're immunocompromised, or if they work in a high risk environment. That is all based on data. As soon as we started clinical trials last year, these individuals have been continued to be monitored this entire time. So some individuals have received 3 doses months and months ago, so we can provide the data to the regulatory bodies to make that data-driven decision. So the data will continue to evolve. The science will continue to evolve. We will continue to monitor the antibody levels in individuals who have been vaccinated. And we do know that vaccine, immunity to COVID through vaccination wanes over time, which is why we're recommending now booster doses for those who are eligible to receive those.
If I can add on to the eligibility. So moderate to severely immunocompromised patients should get the 3rd dose of the vaccine, or Johnson & Johnson excluded. So who are those people? Those people are people who are undergoing chemotherapy, people who have inherited issues with their immune system, something called Wiskott-Aldrich or DeGeorge syndrome, where their immune system doesn't work normally. Somebody who, for whatever reason, is on high doses of prednisone or cortisone, their immune system doesn't function properly. People who have rheumatoid arthritis or Crohn's disease take medicines called biologics, and those medicines impede our own immune system to not attack our bodies, and therefore they're not ready. If our immune system's not ready to attack some of these viruses, so it's not just somebody who is 65 or older, although that puts you at increased risk. But for the moderately to severely immunocompromised, it's people who are in those categories.
Those who receive organ transplants, would they also?
Yes.
Okay.
Yes.
And so a lot of times there's suspicion about there's a lot of times there's suspicion of what's in the vaccination itself. And so I think that's cause for a lot of discussion too. There are some suspicions about maybe some unhealthy elements being added into the vaccine, and that people should be cautious or avoid getting the vaccine because of that. I've heard of all kinds of things, unsafe things, fetal tissue, things of that sort. It causes a lot of concern. Can you speak to that at all?
Sure, I can speak to that. There are no metal alloys in any of the 3 vaccines, which is important to note because science has debunked years and years of misinformation that vaccines cause autism due to metals. That is scientifically proven not the case. As well as there are no microchips, there are no any of those sort of electronic components. None of that is in there. And specifically with the mRNA vaccine, there are only a very few ingredients in there. The mRNA vaccines are different than the Johnson & Johnson. I would let one of the physicians probably speak to what an attenuated virus or viral vaccine is versus an mRNA vaccine. But there are none of those things you see on Facebook that there are microchips in there. That's just 100% not factual.
So with an inactivated virus vaccine, the virus there are protein particles that make up the virus. In an inactivated viral vaccine, think of it as being put into a blender so that the pieces are disassembled and they don't reassemble. And that's the essence of the Johnson & Johnson vaccine. They don't reassemble in our body to form that virus. It doesn't happen. Our bodies respond to it very quickly, and that protein is destroyed over a short period of time. So the difference in the Johnson & Johnson vaccine to the Pfizer and Moderna vaccine is that makeup. And with the other two, the Pfizer and the Moderna, it's actually very elegant because the virus protein that's replicated is not the whole virus. It's just a portion, a very small portion of the virus that this messenger RNA, this template for this protein is made by our own cells, and then our bodies respond to that. I know it's really hard to conceptualize, but it is so elegant how mRNA viruses work. They use our own internal cell structure to help us.
So with an mRNA virus, it really uses components of the actual coronavirus and tricks your body into thinking you've been exposed to it. But you cannot catch the disease unless you actually have live virus invading cells. So, viruses contain genetic material. And what they do is they take some of that genetic material and include it in the vaccine, inject it into the muscle, gets absorbed into the muscle, and then that certain protein that causes the immune response causes antibodies to form. So you don't have the disease, but you have elements of the coronavirus that the immune system recognizes, like, I gotta get this out of here. So your immune system is sort of exposed to it, makes antibodies against it, so it diminishes the likelihood of you actually getting it if you're exposed to the real virus. But you can't get it unless you're exposed to live virus. So the mRNA doesn't have live virus, and as Dr. Davis explained, the viral vector, basically it's a weakened virus or another virus that doesn't have disease in it. And they introduce some of that genetic material from the coronavirus, and it works in a similar manner. It tricks your body to think you've been exposed to it. Your body makes antibodies, which are substances that are used to fight infection, germs, other things that don't belong there. So you won't, I think if people think you can get the disease from the vaccine, you cannot.
I think that is a common myth, is that I think that is a common myth, that you can get the disease or from the actual vaccination, and that might prevent some people from getting it.
Right.
So thanks for clarifying that. So just so I heard correctly, there are no microchips.
There are no microchips.
No.
We cannot see you. We do not monitor you.
All right, and we don't get magnetized then either by the vaccination? Okay, I didn't think so.
So one of the things to point out is most of us carry these. And if so many companies and agencies, they know everything that we do. So I'd rather have the vaccine, even if these myths were not true. People know what we do all the time.
Yeah, that's a good point. You get your car, and your cell phone will tell you how long it's going to take to where you're going before you even get going. Yeah.
So one other common myth that I've heard is that the vaccination will change your DNA. Somehow it gets into your cells and changes your DNA. Is that a possibility? Is there any science behind that?
That there is no science behind that. The vaccines are unable to change your DNA. The vaccines allow you to create antibodies and T cells to fight off exposure to bad things that get introduced into your body. In this case, the coronavirus. Specifically, SARS-CoV-2, the actual virus that causes COVID-19. So it doesn't change you. You're not going to grow a third arm. I'm 99% over 10 months out of both of my vaccines, and I've yet to grow any, tail or anything like that. So completely safe. All of those things are completely false. This is not the X-Men vaccine. You're not going to get a superpower out of it.
I think that's the end of my myth list, I think. Do you all have any other favorites or anything that you'd like to bring up?
Yes, so if I'm fully vaccinated, why do I have to wear a mask? That's a common question that my patients ask me. Because if you happen to be a breakthrough case and you have a mild coronavirus infection, you can pass it on to others who are not vaccinated, or to pass it on to others who are at high risk, even though they've been vaccinated. So remember the Swiss cheese analogy, which was way better than anything I could come up with. That if you're preventing the chances of spread, that's what we're attempting to do. So wearing a mask after you've been vaccinated is important, so that if you happen to be a breakthrough case, you may not have any symptoms and be shedding virus. So that's one of the reasons why we need to continue to wear our masks. And I promise you I will hand sanitize my hands and come up here and hand sanitize here. But it's really important that we continue to wear our masks and to do all that we can to protect each other.
And I would add, Dr. Davis brings up a good point. Fully vaccinated individuals are able to transmit COVID rarely, at very low levels, generally speaking. But that is one of the reasons why when we speak in terms of quarantine, or if you've been exposed to someone who tests positive and you're fully vaccinated, we don't ask that you stay home for 10 days. We don't require you to quarantine. But what we do recommend is that you wear a mask, you monitor yourself for mild symptoms especially. Because of your vaccination, you are more likely to have very mild symptoms, or even possibly an asymptomatic case, which means you could test positive without any symptoms. So that's why we've added on sort of another layer of Swiss cheese, which is a recommendation for testing. So if you're fully vaccinated and you've been exposed to someone, we do recommend now that you test 3 to 5 days after that exposure. Just because what we don't want to happen is exactly what Dr. Davis said, where you may have a very mild case and then be able to transmit that illness to someone else, especially someone who hasn't been vaccinated, someone who couldn't be vaccinated, children under the age of 12, for example. So that is one of the reasons why we've added on, as the science has evolved, this recommendation to test for coronavirus if you are fully vaccinated 3 to 5 days after that exposure, as another layer of protection to really reduce the risk of community transmission.
I'd like to actually ask Dr. Jones a question. One of the questions that I've received has been right in his area of expertise, and that's neurology. Guillain-Barré syndrome, which is a post-inflammatory neurologic problem. I've gotten questions from my patients about, does this predispose me to getting Guillain-Barré if I get a vaccine? So I don't know if you're able to address that.
There have been cases of Guillain-Barré contracted post-vaccine. However, this is not unique to the COVID or the coronavirus vaccination. What vaccinations do is they ramp up your immune system. Now, for whatever reason, if your body starts to identify whatever's in the vaccine as foreign, and if some of those same proteins match proteins that are involved in other normal tissue, then your immune system will attack it. So, if there's certain, I know it gets complicated as Dr. Davis talked about, but if there's certain molecule sequences, for whatever reason that you've been exposed to it, that your body sees as foreign, and all of a sudden, antibodies start forming against that. If you have similar antibodies in the nerves, you can get Guillain-Barré. So what Guillain-Barré is, it's a diffuse inflammatory reaction involving the nerves. And what happens is that patients, a few days after the injection, or it can happen after any viral illness, can happen after surgery, but patients will start to feel numbness and tingling in their feet initially. And then over time, a series of days or so, it starts to ascend up the legs, and then it can involve the arms. In severe cases, it can even affect the breathing muscles and other muscles, other nerves that are responsible for automatic functions such as your heart rate and things of that nature. So that's why it can be life-threatening if it's severe. The likelihood of contracting Guillain-Barré is low. I would gather it's somewhere in that neighborhood of 5% or less. So it's possible, but not likely.
So what's the risk, and if I remember my immunology, the risks of getting Guillain-Barré from a viral illness such as influenza or even after a common cold, there's a risk of Guillain-Barré from that illness, which is dramatically less than the risk of getting Guillain-Barré from the vaccine.
Right.
That's true. Correct?
That's correct. That's correct. So, if you've got a 98% chance of not getting something, now, if I were in Las Vegas, I would take those odds any day. Did we discuss whether or not those individuals, I guess, between getting the flu shot and the
We have not yet, please. Yeah, that's a good topic.
okay.
Everyone.
Sure, I would take that. So there is, normally in the beginning of the COVID-19 vaccination process, we did ask individuals to wait 2 weeks between any other series of vaccine they may have received. But currently, for COVID-19 vaccines, all 3 of them, and your influenza vaccine, there is no waiting period. So you are able to get vaccinated for both at the same visit. So we are doing that in our flu clinics now. We are offering COVID-19 vaccine, but that is something that you can do at the same time. There's no major concern that it's going to cause any more severe illness or any additional side effects or anything like that outside what you would typically see.
Good to know. Anybody want to add any other final thoughts before I open things up to, I don't know if our audience has any questions that we could perhaps entertain?
I would just add that, I continue to be concerned about the fall, the winter. Yes, we did just get through a surge. Yes, we had a highly significant amount of people in our community test positive. Yes, we have seen a slight uptick in vaccination. But one thing that we have learned from this virus and this pandemic is to never underestimate what it can do. And so I think that just leaves me saying we have protection measures in place. Vaccination is there. I encourage you to get vaccinated. If you have younger children who are eligible, I encourage that as well. And then continue to practice safe mitigation strategies, washing your hands, wearing a mask when you're out and about. I know that it is true that this has been turned into a political issue, but public health and health of individuals is not political. We don't care what political spectrum you're on. We don't ask you if you go to the hospital and you need treatment, are you this political party or that political party? We don't care. And you know who else doesn't care? The virus. Because it will attack you and it will make you sick and you will die no matter what your background and ideology is. So I just, stress that. It is a political issue, unfortunately, but we know that the things we've done since day one, nearly 19 months ago, have worked. Those things work, and they will continue to work. And both the public health and the medical community will modify our recommendations for where we are today. And so we just need to be mindful that, in a few weeks, we may recommend that masking isn't quite as important if transmission is low. But just know that those decisions are always based in data. It's based in science, it's based in evidence, and we take all of that very seriously because our job is to be concerned about you all and your health and your safety.
Very eloquently stated.
Yeah, well said.
And there's one word that gets tagged on to the end of that, and it may be a loaded word for some, and that is trust. I trust the science. I trusted the science enough to get the vaccine. If my doctor were Dr. Jones and he recommended, and I trusted him and he recommended the vaccine, I would say, Dr. Jones has my best interest at heart. I'm getting that vaccine. If you don't trust the science, trust somebody who is keeping up on the science. Trust somebody who you have faith in. And that getting the information from somebody you trust is the best way to not be subjected to the myths in the misinformation.
Another very important point, I think, thanks.
I don't know if our audience has any questions at all that they would like to ask of our panelists.
Thank you. So my question is, with the institutions, with the prisons, and also with the nursing homes, in the beginning of the pandemic in 19 and in 2020, we saw that there was a really high rate of the coronavirus at the prisons and in the nursing homes. Has that changed? Is it mandatory for the inmates to be vaccinated? And how about the people in the nursing homes?
I can take that. So it is not mandatory for prisoners or inmates or those incarcerated to be vaccinated. It is highly recommended because they are in a congregational environment. Their risk for COVID-19 is much higher because they can't leave. And that is also true for individuals who are in assisted living, long-term care facilities. Inherently, these are individuals who most often have underlying health conditions. They may have, immunocompromised issues. And so again, those were highly recommended, which is why at the beginning of the vaccination campaign, we made vaccine available to those two groups of people. And that was a very hairy decision that the state made, saying, why are you vaccinating, individuals who are incarcerated and not, a second tier of individuals who are not? And it's because the risk of those individuals contracting COVID and having severe illness was much higher than those of us who were not confined to a congregational living space. I will tell you that in Ohio, our long-term care facilities and assisted living facilities partnered with federal pharmacy partners to provide those vaccinations. And Ohio does have a program in place to continue to provide those to new residents or individuals who move into those congregate care facilities, as well as booster doses for those who are eligible. So it's a federal pharmacy maintenance program is what it's called. And so we continue to be concerned about those living in congregate care facilities, but we know that those were often the first individuals who have been vaccinated. But to that point, I would just add that over the last several months, when we've gone through the Delta surge, the vast majority of our cases came from individuals 40 and under. So in the beginning, in the December, January, November last year surge, it was really those 65 and older individuals who were seemingly attacked by the Alpha variant more than younger. Well, now, because that population is our highest vaccinated population, the Delta variant really targeted those 40 and under. And that's where we've seen a significant number of our cases.
So, now that, and I don't know what the medical terms are, so if I say something wrong, please correct me. So now that the Pfizer vaccination has received regular approval, can an individual who is not immunocompromised or above 65 request through the doctor to get a vaccination like you usually go to get a flu vaccination?
So yes, those individuals are able to receive that booster dose at any point. I will tell you that not all local physicians' offices across the state provide it. Health departments provide it. Adena continues to provide it, but it is really not every local primary care physician office is providing the Pfizer, Moderna, or Johnson & Johnson at this point. But yes, now, I mean, even if it wasn't fully approved, it would have still had emergency use authorization, and you would be eligible for that.
I have a question. I know when everything started, every place we went last year, you entered the building and they could take your temperature. So I would just like to know, what are the guidelines? Is that still recommended? I know in some, obviously, if you go to the doctor's office, some maybe do now. So what is the recommendation now? I know that I know a lot of times fever doesn't really have anything to do whether you have COVID or not. So I just want to know what were the recommendations now for taking temperatures.
I think that's a great question, and I think this points to the fact that our understanding of the disease and illness has changed over time. In the beginning, we knew that a slight low-grade fever was a tall tale sign of potential COVID, but what we have seen more and more over the last several months are very common cold-like symptoms. So runny nose, stuffy nose. A lot of our cases have said, I thought I just had seasonal allergies. And they go to their doctor to be treated or be seen. The physician recommends that they get tested, and it comes back COVID. So what I say and what I recommend is, if you have really any symptom that's not to you what you would consider ordinary for where you are that time of year, consider that you might have COVID. If you have allergies that are sort of unusual, if you have a low-grade fever, aches, pains, you notice that you have a loss of taste, sense of taste and smell, those are all telltale signs of what could be COVID. And testing is fortunately, again, widely available. At the health district, we offer rapid at-home tests. I have some in the back if you're interested in that. If you are watching online or watching this later, we do still offer them at the health district's office. Many local pharmacies, again, urgent care, still has testing capacity. So the best thing to do is to rule out an infection of COVID by getting tested if you think you may have been exposed or have a symptom.
So question, if let's take a person that's already had COVID and I feel like, it's just a mild case and I'm over it, and what would you say to that person that tells you that they have antibodies built up against the COVID virus?
I would suggest that you get vaccinated. Absolutely. That is the best thing to do to ensure you have a high level of antibodies. As long as you are 14 days out of your COVID period and you are asymptomatic, you are eligible to receive the vaccine. And you do have an inherent amount of antibodies from natural immunity, right, from your exposure to COVID and your illness. But what that vaccination will do is really to shoot up that immunity even higher than that natural immunity and provide you a much higher level of protection.
There is no antibody level that says you are immune.
Right.
So if you test positive for antibodies, that means that you've been exposed. Mm-hmm. That doesn't necessarily mean that you're immune.
So this question is about the medical staff. And we see on TV that there are a lot of medical staff, whether it's doctors or nurses, that are opposed to getting the vaccine. And they say that there's just not enough information out there about it. So I'm going to ask each of you to answer this question. I'm going to start with our nurse practitioner, Robin Jones. How do you feel about people that you work with, that are medical professionals that you work side by side with, saying that they're not going to get vaccinated?
Good question. Hello, everyone. First of all, I make it a point not to get into a major argument with someone about why you're not getting vaccinated. I think it's very important that we listen to someone, we acknowledge their feelings, and we try to explain to them from a medical standpoint why we highly suggest that they do get vaccinated. It's difficult working in a hospital setting where you have your colleagues that are not getting vaccinated, when you have patients coming in there who's ill and sick. As it is right now, it's a personal decision. You know, it's not a mandatory thing in any way. So we can't push, and I do encourage that you don't, because a lot of times, as a matter of fact, I had a patient today, and he said, convince me as to why I should take the vaccine. So as we were talking, and I explained to him from a medical standpoint why it's important, and so I said, so tell me, what is it that is your main reason why you don't want to take the vaccine? And one of his reasons was, of course, the fact that a lot of people feel like it was just moved too fast through the process. But his other reason is that he said he just don't like people telling him what he has to do, And I think that's a lot for a lot of people. It's the fact that you have to do it. But if you look at things from a global standpoint, or look at things from a personal standpoint, because I've had family members who've had COVID. I just went to a funeral of a nurse not too long ago who died of COVID. When you have it from a personal standpoint, you have to say, okay, when we're looking at the science and when we're looking at who's in the hospital now, we see that 90% of the people who are in a hospital where they're hospitalized or on beds, 90% of them are the unvaccinated. So that lets you know that the vaccine does work, and it has its place. So like I said, what I do from a standpoint, from a nursing standpoint, is I try to present them with the facts, and just plant the seed constantly, just plant the seed, and that's the way. That's all we really can do. Is encourage them, strongly encourage them, but never make them feel less than.
I agree with Robin that not everybody will take the vaccine, and it's not up to me to judge another person why they won't. I want to listen. I want to hear their reasoning. So if it's a myth, I can provide good information that's based in science. But if somebody says, I just am not comfortable, I say, I'm sorry that you feel that way. These are the things that you can do to protect yourself and to protect others. Wear a mask, social distance, sanitize your hands.
My opinion about that is really more direct, because you wanted to know what providers that aren't following through with this, from my perspective, if you're a physician or an advanced provider, and you're keeping up with your journals and evidence-based medicine, none of them are saying don't get it. None of them are opposed to that. So if we're talking about evidence-based medicine, whatever journal you read, whatever your discipline is going to advise you to try to convince people to do this. And then, as the gentleman alluded to earlier, this is a health issue. It's a health issue. And Robin brought up that, some people see it as a civil rights issue, I guess, which is unfortunate. I really wish we could convince more people to, try to be eloquent in how I say this, but to allow the doctors and the scientists to navigate us through this. You know, I understand that when you trust someone, you can be ill-advised, and therein lies the problem. So if someone who you trust and respect gives you misinformation, then you're in trouble. And then in these days of social media, stinking thinking can be disseminated with the push of a button. Boom, you got tens of thousands of people who are, you know. So I try to, you know, encourage my patients that, you know, I follow, you know, evidence-based medicine. I don't even use the names of certain researchers who, you know, may be connected politically. I'm just saying, you know, the thought leaders in infectious diseases, epidemiology, public health, you know, all these different disciplines that are studying this are saying this is how we get through this. That's my perspective.
Well said.
Thank you.
I would absolutely agree. I think the thing that I find most disheartening is that people are ill and misinformed about the science and the evidence that has led them to having this level of distrust. And, you know, all of us want to make sure that we are doing no harm. And the harm that can be caused by contracting COVID and giving it to a patient who may be hospitalized or maybe in a long-term care facility who doesn't have COVID can really mean life or death for them. And this, we have seen, is a very, COVID is nasty. It's a very long, it can be drawn out, painful process for those individuals who have truly succumbed. And I just think that we just have to be better people to care for our brothers and sisters. And if this is one thing we can do to protect the people who are there under care, then we should feel truly obligated to listen to the scientists, listen to the data, follow the evidence, and get vaccinated so that we don't run the risk of that.
Any other final questions for the panelists?
I just wanted to ask you, we're talking about the increase in the cases in September. So I'm then assuming that also the death rate in Ross County also has increased because of the increase in number of cases.
You are correct. And as we've said it since the beginning of this, hospitalizations and deaths are what we call a lagging factor. I can tell you that not a day hasn't often gone by in the last month or last 30 days where a death has not been reported to us. So those numbers continue to be reported, they continue to go up, and it's unfortunate because we have this truly, I mean, I'm a religious person, I believe in great things, a miracle thing that has been provided through science and data to save our lives, and yet September, October will continue to be some of the deadliest months of this pandemic.
Does that mean we have to worry about the holiday season coming up and all the traveling again?
I think, we have to, so the question is, does that mean we have to worry about the holiday season and traveling? I think we have done a good job of being sort of reactionary to where we think COVID is going, reactionary and precautionary and wearing masks and all of that. I think we are nearing the point. I'm not saying that we are here, but we will have to come to learn to live with what we currently have. Until we get more and more individuals, the vast majority of our population vaccinated, the practices we do today, the mask wearing, the hand washing, knowing where you are and who's around you and are important and will continue to be important as we go through the holiday season. I'm not saying you don't have to have Christmas with your loved ones this year or take a break from holiday traditions. I just think we need to be more cognizant of the things we are doing. And if you are sick or if you're not feeling quite right, the good news is we now have testing widely available for you to make sure that you don't have COVID and you're not introducing that to someone else.
I have a question too, actually. What is the current thinking on groups of individuals who are all vaccinated, fully vaccinated, being in close proximity, like us at this table. Like I'm watching Good Morning America, they're sitting there, none of them are masked.
Yes.
So can you?
I can absolutely explain that. It's situational. I think Good Morning America is a perfect example. They have rigorous testing still in place after vaccination. So you see them unmasked, but because they're getting tested very frequently to really catch those infections that may exist. You know, we still have to remember that our community transmission rate, that was that number I said in the beginning, 344 cases per 100,000, that's still considered high. That means that the virus is still widely spread within our population. So masking, even if you're fully vaccinated, is still a better way to protect yourself than unmasking, gathering with those who are fully vaccinated. This goes back to the Swiss cheese model. It's just another layer of protection. But as I said, I think we are on the right trajectory. I think those numbers are going to continue coming down over the next several weeks. I anticipate them being less than 100, which means it gets us back to where we were during the summer, where we truly felt like things were getting closer back to what the normal is. So if that's the case and we roll around and we're 30, 40 cases per 100,000 and you're around vaccinated individuals, my recommendation would be then you would not have to wear a mask. But we're not quite there yet. We're getting there. These things help. Hand washing helps. Staying home when you're sick is a true help. So those are all the things that will get us to that point where we were in June and July when things felt good. It felt like normal for the first time in a year. We'll get there, but not quite yet.
All right. Well, I hope you all appreciate the wonderful information that we've gleaned this evening. I sure appreciate all of the questions, and I certainly appreciate all of our distinguished guests joining us today. This is a panel that was made possible by a collaboration of community entities. We have the NAACP, we have the Health District, we have Adena represented, and of course we have Ohio University Chillicothe here too represented. So I hope you'll join me in giving our wonderful panelists a round of applause. Thank you all very much. We really appreciate it.